Hey everyone, Dr. Michael Corsellis here. Today I want to talk to you about gout, everyone's favorite pain. What is gout and what are the symptoms and what's the treatment? Gout is very common in guys. It's more common, I usually see flare-ups more like summertime or the holidays. But gout is essentially you're getting these purines, these type of proteins that can cause uric acid to accumulate in the body. Now there are some folks who have high amounts of uric acid in the body without any kind of problems, but there are some folks who just have that bad luck or the bad diet where they get gout. And so when these uric acid crystals, they accumulate in the body and they accumulate in the joints, and most often in the joints furthest away, like in the feet or the big toe. So if you ever wake up one day with your big toe red, swollen, very tender, and you never remembered hitting it, injuring it, stubbing your toe, you probably got gout. What can precipitate those gout flare-ups is diet. So folks who are overweight, obese, if they have too much alcohol, particularly beer, meats, and seafood, those are high in purines, and that's going to cause gout to flare up. And so if you're like, man, I've been drinking more beer, having more barbecue, which tends to happen around summertime, drinking more, eating more meats, that's why I usually see those kind of flare-ups around that time of the year. Gout's treatable. It's definitely a first world problem you see more often. Gout when people are having a poor diet and overweight. That's America, right? We have the pretty much worst diet compared to the rest of the world. And so some other risk factors besides the diet stuff is maybe you're just not drinking enough water. If you push a lot of fluids, that can help flush out that uric acid. Maybe you have too much sugar as well, and that's again, everyone. Sugar and dehydration, those can set you up for gout flare-ups as well. So how do you diagnose it? You can just diagnose based a lot of times on those symptoms, because sometimes if you check your uric acid levels with a blood draw and you're having a flare-up, it's not the best time to actually check uric acid. So often we can check those markers, inflammatory markers, but a lot of it's based on your symptoms. And then we just can treat it with a number of different things. Sometimes, actually going back to diagnosis, if you really want, you can actually draw some fluid out of that joint with a big old needle and to see under a microscope exactly what is going on in that joint. Is it uric acid? Is it gout? Is it pseudo-gout, which is similar types of symptoms? But treatment is for sure those lifestyle things, but you want to lower inflammation. So some folks will just take some ibuprofen, but so it's, of course, talk with your healthcare provider on the best courses of action. But ultimately, if you want to prevent flare-ups of gout, and it's not always just the big toe, it could be in any joint, your elbow, your knee. It's just more common in the feet or the toe. But some folks will for sure need to make those lifestyle changes. And some people, when it's really bad, they need to go on a daily gout medication. Hopefully you won't have to. If you can just make those dietary changes, that'll make a big difference. Now, some natural treatments, some people talk about cherry juice or cherries or dark cherries. The darker the better, the sweeter the juice. But that can help to get rid of uric acid. Vitamin C in high doses can help lower those uric acid levels and excrete it out of the body. So those are two things, but the biggest thing is those dietary changes. So hopefully you're not one of those dudes who walk limping around, because that pain can get super painful. But if that's you, you better get evaluated. All right, hope this helps, and I'll talk to you guys later.